While Jasrina is getting set up, I'm going to speak a little bit on her behalf. She is in her final year of medical school, aiming to pursue residency in internal medicine. She is currently completing her fourth year clinical rotations at various hospitals in Los Angeles. Originally from Ontario, Canada, Jasrina has a passion for helping people, learning about the latest medical advances and community issues.
Okay. Good morning, everyone, or good afternoon. Okay. My name is Jasrina Kaushal, and today I will be speaking about diabetic neuropathy. I'm in my final year of medical school, as previously mentioned, and I've had the honor of working with many different members of the healthcare community here in Los Angeles in various medical placements. And for today's presentation, I definitely feel like this hits home a little bit more for me. So before I actually begin, I wanted to just kind of quickly introduce why I'm here today and why I'm speaking about this very important complication of diabetes. So when my grandmother had diabetes, type 1 diabetes, and unfortunately, she's no longer here with us today. She passed away when I was younger, but I have seen how it can affect an individual as well as other members of the family. So I really hope that I can do my part in helping manage and treat diabetes and help people. I have been told by many family members, especially my mom, that I'm very similar to her in certain ways. She had a certain zest for life. She liked bringing the community together. Actually, she was a principal in India, so she really liked helping children and bringing the community together in that aspect as well. So this presentation is dedicated to my grandmother, Shobha Malik, as well as anyone else who might have diabetes or have family members that have diabetes as well. Okay. So during the presentation, we will explore the signs and symptoms of diabetic neuropathy, ways to slow the progression, care management, and interventions. Additionally, we'll delve into the impact of diabetic neuropathy on the quality of life of individuals living with diabetes and the importance of managing and preventing this condition. There are different things that we can look into to help slow the progression, which I'm going to be talking about as well. And we'll also discuss the importance of proper blood sugar management, lifestyle changes, medications, and other forms of treatments that can help manage the disease. By the end of the presentation, I hope that you have a better understanding of diabetic neuropathy and how it affects those living with diabetes, as well as various options available for managing and treating the condition. So I thought I would just give a really brief introduction about diabetes. I know there have been other presentations about this, so I'm not going to spend too much time, but basically, as we know, diabetes is a group of metabolic diseases that's characterized by elevated blood glucose, and also known as hyperglycemia. So when our body breaks down food that we eat into the bloodstream as glucose, the pancreas secretes the hormone known as insulin, which then enables the glucose to be entered into the cells and utilized as an energy source. I like to think of it as insulin being the key that allows glucose to be entered into the cells. And then with diabetes, so diabetes is actually a pretty broad term. As you may or may not know, there are different types of diabetes mellitus, type 1, type 2, gestational, for example. And I'm not going to go into the details of each specific type of diabetes, but essentially your body doesn't make enough insulin or it's not being able to be utilized as it should. And when there isn't enough insulin, our cells stop responding to the insulin. This can lead to hyperglycemia. Chronic hyperglycemia is associated with microvascular and macrovascular contribution, which I'm going to explain a little bit in the further slides. This can ultimately lead to kidney disease, nerve damage, also known as neuropathy, visual impairment, amputations, and heart disease. So neuropathies is actually a pretty broad term as well. It's characterized by progressive loss of nerve fiber function. Our body is composed of so many different types of nerve fibers, which have different functions, for example, touch or, movement, feeling temperature, feeling pain, for example. And diabetic neuropathy is actually one of the most common complications of diabetes. It can affect as many as 50% of patients. So it is a really important condition, something that we are hoping we can help treat, and especially with ways to slow the progression of it, which I'm going to go into as well. And the formal sort of way to describe diabetic neuropathy is that diabetic neuropathy involves the presence of signs and symptoms of peripheral nerve dysfunction in people with diabetes mellitus after other possible causes have been excluded. This is important because a lot of these symptoms that I'm going to be discussing shortly can be very vague, can also be caused by various other types of conditions. So that's why it's usually a diagnosis of exclusion. Diabetic neuropathy encompasses a range of different conditions that impact the nervous system as a result of hyperglycemia and microangiopathy. What this means basically is that these high blood glucose levels cause the cells that line the blood vessels to take up more of this glucose. This causes the blood vessels to become thicker and unfortunately weaker as a result. And this can manifest in many different ways, but in terms of diabetic neuropathy, these nerves are not receiving the blood because of these blood vessels have become weaker and thicker, and therefore they're not receiving these nutrients that they need to function properly. And this is why this condition can manifest so differently, because it really just depends on the type of nerve that's not receiving these nutrients or this blood supply, or the location of these nerves. The main types of nerve damage seen in diabetic neuropathy include distal symmetric polyneuropathy, small fiber predominant neuropathy, radical plexopathy, mononeuropathy. And these conditions can result in significant patient morbidity, increased mortality, and pain, unfortunately. So this is the classification system that was proposed by P.K. Thomas and recently modified in a recent position statement by the American Diabetes Association. I'm not going to go into too much detail about the differences here, but I just think it's important to note that the disease or the condition can be presented so differently. For example, with small fiber neuropathy, we're seeing that it's symmetrical. It's affecting both sides of the body pretty equally. It involves predominantly the sort of distal area, so your fingertips as well as your toes or your feet. And it seems to affect the small diameter sensory fibers known as A, delta, and C fibers. This can manifest as pain. The patient sort of perceives this as a burning or stabbing pain, for example. There's also a loss of temperature sensation. So that's just kind of an example. I'm going to go into detail about the different symptoms shortly. So I mentioned earlier that distal symmetrical polyneuropathy is one of the types of that this can present as, and it is actually the most common manifestation as well. In type 1 diabetes mellitus, we'll see that distal symmetrical polyneuropathy typically becomes symptomatic after several years of prolonged hyperglycemia or untreated diabetes. Whereas in type 2, we'll see that it can manifest pretty early on, just after a few years. And so, with that being said, diabetic neuropathy, like I mentioned, can manifest as a wide variety of symptoms. I've kind of categorized it as sensory, motor, or autonomic symptoms. And this is from a paper that I read recently where the author suggested a structured list of symptoms should be used as a screening tool. So I think this is very important because a lot of these symptoms, like I mentioned, can be very vague. You might not really think it's a big deal, like, oh, like I'm having sort of this pain in my hand. I'm not sure. Maybe I just slept on it weird, or maybe you're not thinking about it like that. But if you have this list, the structured list of these potential symptoms and are more aware of it, I think it could really help in the progression of the disease if patients are able to sort of recognize the early signs and symptoms. So I'm going to begin by talking about some of the sensory symptoms associated with the disease. Sensory neuropathy is usually pretty insidious in onset. most often presents with a stocking and glove distribution, meaning your hands and your feet. Some of the negative sensory symptoms include loss of balance, getting injured and not feeling any pain, feelings of numbness, or sort of a deadness type feeling. Patients sometimes describe this as they feel like they're wearing gloves or socks, but they're not actually wearing gloves or socks. Some of the positive sensory symptoms are burning pain, tingling, aching, and electric shock-like pain, or very hypersensitive to touch. In terms of motor symptoms, we'll see patients are having a bit more difficulty with fine hand coordination in terms of simple tasks. This could manifest as even just, oh, I've been having a little difficulty turning keys lately, or opening jars, tying a tie. There's also foot slapping or dropped foot gait. This can be an early sign of diabetic neuropathy foot weakness. Patients also seem to have difficulty climbing stairs, difficulty getting up from a seated position, or difficulty raising arms above their shoulders. In terms of the autonomic signs and symptoms, this can involve a vast variety of different organ systems within the body. For example, in the GI system, we'll see a lot of patients having gastroparesis, which can manifest as nausea or vomiting after eating. They feel like they're not fully digesting their food properly, which causes the nausea, as well as difficulty swallowing, abdominal pain, diarrhea, constipation. In terms of cardiovascular, this can present as persistent sinus tachycardia, which is increased heartbeat, or orthostatic hypotension, which is when your blood pressure decreases when you stand up, as well as an irregular heartbeat or altered blood flow, as well as edema. Specifically, I would say more so peripheral edema or peripheral swelling of your legs. Patients may also have a poor urinary stream, or they feel like they're not completely emptying their bladder when they are using the restroom, difficulty starting to void, erectile dysfunction. In terms of pseudomotor, one of the more, I guess, specific ones that we're mostly seeing with diabetic neuropathy would be gustatory sweating, which is when the patient feels sweating and flushing of a patch of skin near the ear when they eat their food. So, like I mentioned earlier, those symptoms are pretty vague. They can be caused by a variety of different health complications. But in terms of diabetic neuropathy progressing, the diabetic foot ulcer or plantar foot ulcer is the major complication with diabetic neuropathy, and it's affected by both sensory motor and autonomic pathways that lead to the disease. Within sensory neuropathy, the tissue is exposed to increased trauma. The patient doesn't really feel pain, so they don't really feel like anything's going on in their foot, so they don't check their foot. In terms of autonomic neuropathy, we're seeing that there's less blood circulation to the area. Again, less nutrients are being delivered, so it's going to be more prone to infection as well as ulceration. In terms of motor neuropathy, we're seeing that there's atrophy of the muscles, which means basically that the muscles are not functioning properly. This causes increased susceptibility to callus formation, as well as skin breakdown and ulcer formation. So management of diabetic neuropathy focuses on controlling blood sugar levels. That is definitely the main key. I'm going to go into detail about that moving forward. But there are some other things that we look into. I would also like to note that it really just depends on the symptoms. If a patient is presenting with more pain, more sensory symptoms, we're going to treat more so those symptoms versus a patient who might have gastroparesis or difficulty swallowing. We're going to look into those symptoms. So symptom management really just depends on the modality of what the patient is going through at the time. But controlling blood sugar levels is, of course, very key. Medications are geared more towards those specific symptoms. There's also physical therapy, which is shown to be really great. I think exercise is always a great way to improve strength. Foot care is extremely important. I know this was also mentioned in the previous presentation, but I'm going to be going into a bit more detail about that as well. This is just to help prevent the complication, which is the diabetic foot ulcer. Lifestyle changes, of course, eating a healthy diet, quitting smoking, for example. There are some alternative therapies that have been suggested. There's been a lot of research lately on acupuncture as well as biofeedback, as well as counseling support groups, basically helping the overall well-being of the individual. But of course, it's always important to collaborate with a healthcare provider to see what might be best for the individual patient at hand. So, of all treatment options, tight and stable glycemic control is one of the most important factors for slowing the progression of diabetic neuropathy. There was actually a trial done recently with the diabetes control and complications trial, which demonstrated that tight blood sugar control in patients with type 1 diabetes decreased the risk of neuropathy by 60% in 5 years, which is pretty huge. We haven't seen, there still are some more prospective studies done in terms of patients who have type 2 diabetes, but basically reiterating the fact that being aware of your blood sugar levels is very key in slowing down the progression of this disease, specifically with type 1 diabetes, but also there are some positive effects that we are seeing with type 2 diabetes as well, in terms of controlling your blood sugar levels, making sure you're taking your medications correctly and at the right time as well. In terms of diabetic neuropathic pain, there are a few first-line treatments that we are looking into. So that would include SNRIs, such as duloxetine, TCAs, gabapentinoids. For more painful diabetic neuropathy, there's also dextromethorphan, morphine, tramadol, and oxycodone, as well as some topical treatments such as capsaicin or transdermal lidocaine that can be used in some patients, especially more localized pain. So this is just a little bit of an algorithm that I found with one of the articles that I was reading recently. And I think it's interesting because a lot of patients might also be dealing with comorbid diseases such as depression, for example. And if that is a situation, then a treatment such as an SNRI, duloxetine, would be really great in helping that patient who also has diabetic pain because it helps with the depression as well as the diabetic pain. There's also TCAs, but they aren't necessarily first line because they do have a lot of side effects. So this is just, again, just a little bit of an algorithm to help narrow down some of the key drugs that are used in today's treatment for diabetic pain. But I do think it's important to treat the individual as a whole, look at their whole medical history, see what medication might work best for that individual. There's also been some research done recently with the TENS, or it's like a biofeedback machine. It's called transcutaneous electrical nerve stimulation, which is actually quite interesting for me personally because I actually worked at a wellness clinic prior to starting medical school, and we used to use TENS machines on our patients a lot during that time. I didn't know too much about it back then, but I'm learning a lot. And this was a recent study that I read about the TENS machine and in conjunction with neuropathic pain. It was a 4-week study of the TENS applied to the lower limbs, each for 30 minutes daily, and pain relief was noted in 83% of the patients, compared to 38% of patients who were not using the TENS machine, but were on sort of their pharmacological treated group. And with that being said, it seems like this TENS machine could be a really great adjunct to an individual with diabetic pain, and combine this with their pharmacological treatments. Acupuncture is also gaining a lot of popularity these days. There's still a lot of prospective studies that are going on with its effectiveness in treating neuropathic pain, but it's definitely something to look into, I believe. Okay, so we spoke about the treatment for neuropathic pain, which is more of the sensory symptoms we're seeing with diabetes neuropathy. Now I'm going to talk a little bit about gastroparesis. So again, this is when an individual feels sort of an incompleteness, or maybe they're getting food stuck. So I would say first and foremost are lifestyle modifications, small and frequent meals, head of the bed elevated, possible vitamin supplementation. There's also pro-mobility drugs such as erythromycin and metoclopramide, as well as Miralax, which is actually also gaining increased popularity. There is surgery as well, and that's for patients who are experience intractable gastroparesis. This can often lead to very, very severe nausea and vomiting. So that would definitely be down the line if medications or other forms are not really helping the individual. Surgery is available. I spoke about orthostatic hypotension earlier, when the blood pressure decreases as the patient rises. So to help combat that, increasing dietary fluid and salt intake, compression stockings have been shown to help a lot with that as well. In terms of the gustatory sweating, which is when the individual has, they're starting to feel like little sweating as they're eating. There are some compounds that can be applied to help with that. There's also diabetic foot treatments that we're looking into. So if it's in more of an acute setting, we may suggest a foot cast. If it's more of a chronic setting, there's footwear, infection management. There are also medical treatments for infections, as well as surgery if need be. Okay, so we spoke a lot about the pathogenesis of diabetic neuropathy, how it can manifest as well as the treatment options available. Now I'm going to talk a little bit about approach considerations, what we can do as providers or people in the medical community, as well as patients, to treat the disease, slow the progression, and signs that we should look into. At the time of the initial diabetes diagnosis is crucial for the primary care physician to be vigilant for the development and presence of neuropathy. So failure to diagnose diabetic neuropathy can have serious consequences. This can lead to disability, amputation. Therefore, managing diabetic neuropathy from the start would be really key in helping slow that progression. It's important to note that any patient who displays any sort of clinical evidence of diabetic neuropathy should be considered at risk for foot ulceration, and education on foot care should be provided. Many patients end up needing to get their foot amputated or become disabled if this is not taken care of. So that's why this is really key. With that being said, the pharmacist, nurse practitioner, primary care provider should educate the patient on harms of smoking, need for better blood glucose control as well. In addition, patients with diabetes need to be taught about appropriate shoe wear and control of any signs of hyperlipidemia as well, because that could also contribute to the disease. We also recommend being referred to a neurologist throughout the course of the disease. Um, they are able to sort of help in terms of being able to treat the condition a little bit more thoroughly. Um, we also recommend that the patient should have frequent follow-up examinations with a focus on foot inspection once again. In terms of the social worker should be involved in the care to ensure that the patient with diabetes has support systems and that finances, and this doesn't jeopardize any of their care that they need. We also recommend dietitians to improve with lifestyle modifications if need be as well. So it really is a team effort here. The collective should work together as a whole in terms of preventing any progression or any of these serious complications that we can see with the disease. Apart from the healthcare providers, patients should also be very vigilant in the course of the disease. They should make sure that they inform their healthcare provider if they experience any symptoms of diabetic neuropathy. That's also why I mentioned earlier that I think it's great to have the list of the sensory, motor, and autonomic system symptoms at hand for the patient, so they can always direct to that sheet and see, oh, I've been kind of feeling a little numbness in my hand lately. This is also a symptom of diabetic neuropathy. Maybe I should contact my primary care physician to see if anything else is going on. I should definitely seek treatment properly if there are any issues. And again, taking proper care of your feet. I know I've mentioned this quite a few times already, but it really is important. Actually, there was a video I watched the other day about a nurse who works with a lot of patients who have diabetes. And she has her set list of questions that she asks every patient. But she specifically asked, when you take a shower, are you also washing your feet? And a lot of patients were like, oh, I didn't really think about it. I didn't know that was a thing. And she's like, it's actually really important. And maybe it sounds a little silly to talk about, but it's just something that can be incorporated into everyone's daily and something maybe they don't think about, but making sure that they are taking proper care of their feet, washing their feet, inspecting their feet is really crucial, especially if they're not feeling any pain. It might not be aware that anything is actually going on. We also could recommend maybe using a mirror to properly check the soles of the feet if you aren't able to see it, or just want to be a little bit more thorough as well. There also are ways to protect your feet using lotions. If required, there are special shoes that are available. And I believe Medicare may cover the cost of certain shoes. I'm still kind of getting used to Medicare versus Medi-Cal here in California, but that is something to be looked into as well. And you can ask your healthcare provider about this possibility. Exercising is important, but there's definitely a fine line between exercising too much or too little. So again, this is something like it just depends on the course of the disease, the individual, what they're able to do. But in general, exercise is key. Just have to be a little bit more careful if you do have diabetic foot or foot ulcer. Okay, so I'm just going to talk about a few resources that can be used. The Kidney Cast Foundation, of course, has been a really great place. There's a lot of support education groups, monthly workshops, one-on-one consults, as well as the conference that's held every year. The American Diabetes Association also has their National Diabetes Prevention Program, which is a research-based lifestyle change program. You can check the website to see if there is one close to you for more information. They also have something called My Food Advisor. Not everyone can obviously afford hiring a dietitian, so sometimes it's nice to use these resources to see what type of foods you should avoid or should eat more of to help combat diabetes. Okay, so in conclusion, diabetic neuropathy is a common and very serious complication of diabetes mellitus. It affects millions of people worldwide. As I mentioned earlier, it is the most common complication of diabetes, and it's caused by hyperglycemia over a long period of time, which can result in a range of symptoms that we've mentioned, such as the pain, numbness, tingling, muscle weakness, as well as the difficulty swallowing, excessive sweating, for example. Early detection and management of diabetic neuropathy are very crucial in preventing further damage and improving overall quality of life. This includes checking your feet every so often, more follow-ups with your primary care physician. This can also be achieved through a combination of lifestyle medications, blood sugar control, as well as different types of medication or even therapeutic interventions if need be, such as the TENS or acupuncture, physical therapy that I mentioned earlier. And basically the take-home message that I wanted to bring home today was that, while there's no definitive cure for diabetic neuropathy, effective management can significantly reduce the impact of symptoms and prevent further complications. such as the diabetic foot ulcer, which is the major complication of the disease. Regular checkups with healthcare professionals, including endocrinologists, podiatrists, neurologists, are very, very key and important for monitoring and managing the condition. Overall, it's really important to raise awareness of diabetic neuropathy by promoting early detection. Management is essential, and hopefully we can work together to help combat this disease, prevent the progression of it, and prevent any major complications. Okay, so that's all that I have for today. Thank you so much, everybody, for listening. Okay. Oh boy.
This is coming from Rick. He wants to know, is it possible to reverse neuropathy with blood sugar control in the normal range in type 2 diabetes?
Okay, great question. So in terms of it being reversible, I don't believe it is reversible. However, I feel like it can be more effectively managed if you are taking proper medications, if you're taking care of yourself. I think that's super key. It will prevent the progression of it getting worse. But unfortunately, in terms of being irreversible, I don't believe so, at least not to my knowledge.
Okay, and let's see, Jasrina, we have another one. This is coming from Cindy. What are the contributing factor to diagnostic neuropathy?
Okay, so thank you, Cindy. So some of the contributing factors would include not taking proper medications or not taking proper care of your blood sugar levels. Like I mentioned earlier, the glycemic control is very, very key here, as well as some of those lifestyle modifications in terms of quitting smoking, living a healthy lifestyle. Those can all really play a key role. There's also been some studies that have shown individuals who maybe lead a more sedentary lifestyle that could contribute a little bit more further to the progression of diabetic neuropathy as well.
Okay, this is coming, looks from Angelo. For diabetics already that are on dialysis, what would be the range for glucose suggested, 100 to 200s?
Yeah, that's usually the range that we do look for in terms of glucose control. There's also the HbA1c monitoring that we do as well. But I would say the 100 is a good 100 to 120 is a good range to look into. Once you start going above that or below that, we do get a little bit concerned.
Fantastic. Okay. What type of medical specialty do you aim to pursue?
Okay. So I'm currently in my final year and I'm going to be applying for residency very shortly. I do have a lot of interest in internal medicine as well as family medicine. In terms of specializing further, um, as I mentioned earlier, nephrology is definitely something that I'm very interested in, just the study of kidneys, kidney diseases, which is also why I'm here today. But I still have some time to figure it out. So as of right now, those are my top.
Anybody here have a question? Those are online.
Yes. Yes. I had a patient who had terrible gastroparesis at one point, and I was wondering, do they ever do? Do they still use what is it, Botox to help with that?
Oh,
It was
yeah.
incredible for her, and I haven't heard that much about it since.
Yeah, Botox actually, it's interesting that you say that. So Botox has been used for a wide variety of sort of esophageal issues. I know that it's been used for something called Zenker's diverticulum, which is when they have a feeling of food stuck in their esophagus. In terms of gastroparesis as a whole, I do believe there is more research being done on that as an effective treatment option. I wouldn't say it's first line just as yet, but I know it's definitely being used a lot for a lot of those types of GI or esophageal issues.
Yeah.
So definitely something to kind of keep in mind as well.
Yeah, and migraines as well. But yeah.
Yeah.
And what about nerve ablation? I have a friend who's got a nerve that's being really hurt, and they're talking about like ruining the nerve root. Would that ever help like with some of the pain from neuropathy, or is it too more web-like in diabetes?
Yeah, see, that would be really difficult for me to answer. I think it really just depends on the nerve that's affected, because in which nerve root it's coming from, because we're not sure if it could sort of alter other pathways, and with that, if it were to be ablated. So that's really on an individual basis. A neurologist would probably be better fit to answer that question. Yeah, but there's just so much more. Yeah, there's so much research being done on ways to combat this apart from the pharmacological modalities being used. So it's really great that you brought that up, actually. Thank you.
Okay. Could you comment on the prevention of diabetes in the general population?
Sure. Okay. So I think in terms of the general population, leading an active lifestyle, eating healthy, not really contributing in any of these uh, disease modifying situations such as smoking or drinking excessive amounts of alcohol. I think overall being a healthy individual, making sure that if you do have a family history of it as well, be a bit more vigilant on your glucose intake. I would say that's really key. But I think overall, just trying your best to live an active, healthy lifestyle. Sometimes, especially if you're more prone to it in a genetic basis, there's not much we can do to prevent it. But why not try our best to live our best, happy, healthy lives?
Okay, we have another great question here. Can diabetes be reversed mainly by diet and lifestyle in the early stage, maybe within 1 to 2 years of detection?
Hmm. Type 1, definitely not. Type 2 diabetes, if I believe if the individual is pre-diabetic, that's definitely something that can be done in terms of they are dealing with type 2 diabetes. That would be hard to say. I think they would be able to better control it for sure with healthy lifestyle and glycemic control. But in terms of completely reversing it, it would really depend on how the patient did get type 2 diabetes, because there are different ways an individual can get the disease as well. And again, if there's a genetic predisposition, that would be a little bit tougher as well. But in terms of pre-diabetes, I believe so.
Okay. Can you make a comment on the importance of sleep?
Oh, okay. Yeah, sure. I actually think sleep is so important. And I feel like today, especially nowadays, people don't recognize how important it is. So when we sleep, our body actually regulates a lot of hormones, one of them being cortisol. And when an individual is not getting enough sleep, this can actually raise their cortisol levels. And cortisol can actually also contribute to high blood pressure, hyperglycemia, or I'm sorry, high sugar levels, so hyperglycemia. So as an adult, I actually recommend 8 hours of sleep. I mean, personally, if I have less than 7 hours of sleep, I definitely feel it. So I think it's super important, not just in terms of diabetes management, but overall well-being as well. I think 8 hours is a great. I know not everyone can always achieve that, especially if they're a little bit busier, if they have a lot going on, or maybe they have a newborn or a puppy. I don't know, but I definitely think try to get 8 hours if you can. 7 hours maybe minimum, and this does range depending as well on age. So of course, children need a little bit more sleep as well as newborns. The geriatric population, so a little bit older individuals, um, tend to not get as much sleep naturally as well. So that's something to kind of keep in mind. But 7 to 8 is great.
Okay, great. Thank you for that. Um, could you possibly comment on the relationship of arthritis to diabetes?
What, sorry?
comment on the relationship of arthritis to diabetes.
Okay. Okay. In terms of if they're like can cause one another or just
Yeah, I'd say probably that's it. I'm getting the text here, so
okay.
I would say yes.
Okay, so arthritis is a little bit different. It's an autoimmune. It is also an autoimmune condition that affects our joints. In terms of its correlation to diabetes, I'm actually not sure about that. However, if you do have arthritis and have diabetes, you might be prone to some of the more motor symptoms of diabetic neuropathy, or you might even they might even kind of conjunct a little bit in terms of that weakness that we might see. A stiffness, that's a huge one for arthritis as well, or rheumatoid arthritis, I'm assuming, because there are different forms of arthritis as well. There's like osteoarthritis, which can present a little bit differently. So I hope that answers that question. It was a little broad. So I'm not sure.
I believe that sounded great. Yes, Rod.
I have
Okay. Wait, like in terms of the patient education?
probably, yeah.
Think we got it? Wow. Okay, well, let's give a great round of applause. Thank you, Jasrina. She's
you.
in her final year of medical school. What a bright future you have waiting for you. So
Thank you so much. Thank
we
you
sure
everyone for
appreciate you.
listening. I really appreciate it.
Fantastic.
I have a question. I saw the truth in advertisement. It used to be commercials that, okay, with that you will lower yourself to less than 7 AIC7, and by that you're no longer diabetic. Is there a truth in that?
Um, sorry. Oh, okay. I'm so sorry. Would you be able to repeat that beginning part of that question?
Yes, I saw there were commercials, which I always doubt, about some medication that will help you to lower the AIC below 7. And the conclusion was for the advertisement that you are no longer diabetic. Is there any truth to the matter in it?
So there are definitely a lot of medications that will help lower the HbA1c. Is that the HbA1c? I'm assuming that's what you meant. In terms of completely reversing diabetes, I'm not sure about that. I don't know about that claim specifically, but I know there are many medications out there that can really help control the blood sugar levels and lower the HbA1c. I don't think that would completely reverse diabetes, but it definitely is a great treatment option. And again, this really just depends on the patient if they are considered pre-diabetic, type 1 diabetes, or type 2. So I would look at it as a whole and specifically what medication that is and what it's targeting as well.
Thank you. Thank you.
Okay. You're welcome. Okay. All right. Thank you, everyone. I really
Thank you,
appreciate
Jasrina,
it.
once again.